Well, I'm delighted to be able to provide a brief snapshot today of what consumers think around general practice nurses in New Zealand. And I'm presenting on behalf of the research team, and I need to acknowledge Liz Halcombe, who's the lead researcher, who unfortunately has been scheduled in another session. So I get to give you the whole presentation, but I may not be able to answer all the questions. So my role is as a member of a research committee in the College of Primary Healthcare Nurses in New Zealand, which is our largest professional body with a membership of around 1,200 primary healthcare nurses at the moment. So just a little bit of background to the research. The primary healthcare strategy in 2001 was quite clear in its intent around primary healthcare nurses being critical to the strategy, as alluded to by Professor Jenny Carrier this morning. And despite a long history of practice nursing in New Zealand, we've become aware that there was actually no formal evaluation of consumer satisfaction with practice nurses in their role, though of course over the time of this study there has been some associated research. And we do know from the extensive literature that increased consumer satisfaction can improve compliance with recommended therapies and around people coming back to the general practice for necessary care, and around compliance around improving health outcomes and quality of life. So why did we conduct this research? Back in 2008 I had the pleasure of attending a Welsh and UK study tour with the Ministry of Health, and I need to acknowledge the former Chief Nurse Mark Jones in the room, who was one of our key mentors around this study. And we did 2 weeks of quite an up-close examination of the context of general practice nurses in the UK. We returned with much enthusiasm regarding potential role development, but we were also aware of limited, very little literature on what consumers thought of practice nurses. So the very small study we conducted sought to achieve 2 aims. The first one clearly was around how satisfied were consumers with practice nurses in New Zealand. And secondly, through a developing association with the Australian Practice Nurse Association, we were aware that they'd already tested and validated a general practice nurse satisfaction, a GPNS scale, and we were pretty keen to test this in an international setting. So that's the context as to why we did an international study. So when we look at the method, we called for practices and practice nurses to recruit from the extensive networks of the College of Primary Healthcare Nurses, and once we got them on board, we went through quite a structured process where admin staff at the end of the consultation requested consecutive patients, participating practice nurses, to partake in the study. All the consumers were asked to complete the survey and return it in the box. Alternatively, they could post it to a central point, and we did receive quite a few in the mail as well. Additionally, we also asked the practices to ask the consecutive clients again as to whether they would participate in subsequent telephone interviews, and we'll talk about that a little bit later. Our surveys were then scanned and then into data analysis, and then the second part of the method was around the telephone interviews, which, as you can see, were audio taped, transcribed, and some thematic analysis undertaken by the Sydney team. So just a little snapshot here of the demographics of the participants. We managed to engage 20 general practice teams and a total of 89 practice nurses from around New Zealand. As you can see, 2/3 of the practices were urban, 16% urban rural, and the remainder rural. The mean experience of the practice nurse was about 11 years, and 91% of them were employed as registered nurses. We did have a couple of enrolled nurses and nurse practitioners as part of the sample. We got a total of 1,505 consumers that completed the survey, and interestingly, over 80% of them were expecting to see the practice nurse at that visit. This basically shows the mean general practice nurse satisfaction, or GPNS score, across the 20 practices, and as you can see, it ranges from 88 to 100%. So it overall demonstrates high levels of satisfaction with the practice nurses, but such a ceiling effect is common in nurse satisfaction research and highlights the need for that qualitative data from the interviews to actually tease out some of the issues. When the practices got access to their data, they were provided with their mean scores across the different items, but they were also benchmarked against the mean as well. So those that were on the lower level of the scale in the different items could actually identify that, and we can support them with addressing any of those needs. So we'll just have a look at a few of the factors that affected the total GPNS score. There was no significant difference based on age, gender, insurance status or employment type, which was interesting when we compared to the Australian study, where women and younger people were more satisfied. And interestingly, participants were feeling worse than last year were significantly less satisfied compared to those that were feeling better than last year, and that's overall. So when we look at the trend associated with the number of times the patient had actually visited the practice nurse, the more often that they go to the practice nurse, the more satisfied they tended to be. And that may be related to the established relationship with that nurse in that practice. So then we went on to conduct 18 consumer interviews. So they were conducted across the telephone by the research team from Sydney to further test out the GPNS scale. And we had 4 key areas of findings through the thematic analysis. I'm going to overview each one of these. So the first one was around satisfaction with the practice nurse. And overall, the participants were extremely happy with the care delivered by the practice nurse. And we had a couple of sub-themes that really came out in those interviews around the perceptions of being valued by the practice nurse and in that developed relationship. So the participants that were interviewed were expressing that they felt like they were being listened to and treated as a person, and in contrast to the experiences with doctors, several participants expressed how they felt valued. The sub-theme 2 under there was around the ability to build up a rapport with that practice nurse and the team. Participants described the benefits of developing an ongoing relationship with the practice nurse, and the willingness of the practice nurses to establish and build a rapport with the consumer and their family was also highly valued. And in contrast to the benefits of the ongoing relationship, as you can see with the last participant there, some participants described the negative impact of not having an established relationship related to that visit with the practice nurse. The second theme to come out of the thematic analysis was around confidence with the practice nurse. So practice nurses were perceived by these consumers as being knowledgeable and competent. They appreciated the detailed explanations given by practice nurses about their chronic conditions in particular and the need for particular treatments or lifestyle changes. Further confidence was also related to the perception that the practice nurses would be working within the interdisciplinary team and would refer appropriately whether the patient or the nurse deemed it was necessary. While there was some indication that consumers wanted to retain the choice to see the GP if they chose to, the confidence that the practice nurse would seek the advice of the GP was seen as reassuring, and participants spoke positively of the practice nurse role in triaging when they needed medical attention. And this is particularly important given the New Zealand agenda around integration and the focus on access to primary healthcare services and the increased expectations on general practice, particularly around acute care needs. The third theme to come in the thematic analysis was around confusion around the practice nurse role, which we've heard some of that alluded to earlier with Professor Jenny Carrier's presentation. So for some participants it was unclear who actually the practice nurse was, and that may be related to how practice nurses introduce themselves and how visible they really are, and the confusion, as James said, around, so is it somebody that takes the blood, is that really a practice nurse, or is that actually a phlebotomist? A few participants had actually described how the role of the practice nurse had changed, although others indicated that they'd clearly not been given a lot of information around the role and only came across the practice nurse when they were referred from within the team. Several participants did indeed express a lack of clarity around the role and the scope of practice, which we'll talk about a little in the conclusion. The fourth theme to come through was around the appreciation of accessibility. A common complaint amongst participants was the difficulty they encountered in making appointments and receiving treatment from their GP. Contrary to this experience of having to wait for extended periods of time for the GP appointment, Practice nurses were seen as really readily available for consultations, and consumers valued not having to wait to see the practice nurses and appreciated them being contactable by telephone if support or advice was required. Again, this is important to consider in the New Zealand context around appropriate time for practice nurse appointments, being available the same day and also via the telephone. And of course, since this research, there's a lot more e-health going on, the availability of the practice nurse via the email as well. Another part of the accessibility was around cost as well. Accessibility of the practice nurses was also enhanced due to the lower financial cost for the consumers. So in New Zealand, we are working in a capitated environment which funds about 60% of the general practice funding, and the other 40% does come from the private purse. So accessibility was enhanced due to lower financial costs for the consumers, and it was important for those consumers who are low income earners and pensioners. Participants also reflected on the value for money in seeing the GP rather than the practice nurse. So once again, very important reflections in terms of perceived value and affordability. Members of the general practice team. So where does that take us? These findings have significant implications for the planning of primary healthcare nursing services in New Zealand. For us, the awareness of the role, the development and the work with funders and planners, policymakers and the New Zealand Nurses Organisation regarding increasing the profile of practice nursing is key. Clearly there's a lot of work to be done around full understanding around the role and scope of practice nurses in New Zealand. The second opportunity around communication, around to be able to utilise the ability to connect in terms of opportunistic healthcare screening, health education promotion and screening for current health concerns. Nurses are well educated to provide this care, but aren't necessarily working in a context that allows them to do that. So once again, a really important consideration for funders and policymakers around the amount of time and accessibility we provide for practice nurses. And the final one around the ability to respond to needs in congruence with Jenny Carrier's longitudinal long-term research that we heard a little snapshot of this morning and her reflections on her leadership journey. The importance of the practice nurse ability to respond to the needs around being accessible, affordable, and it's certainly in terms of the long-term high-volume users, those people that really are missing out on the care they need. So, thank you for your time today. Sorry, I should have just said that the slides won't actually be made available, but if you want to take down a note of the links, it's just that we were waiting publication of the second publication. The top publication that was released in January this year is freely available. So.
Now, that was amazing, and as a practice nurse I found that very inspiring to think that the things I think I actually do, the patients think I actually do too. And there's a lot of translatable things back to us in Australia as well as New Zealand, I think. Is there anyone who has any questions here? Yes. Thanks.
Debbie, did you find that when you were interviewing patient visits to practice nurses, was that different in the different demographics? So you said you had rural area, semi-rural and city. Were there any sort of areas that you identified as tend to have a high use of practice nurses?
It's a really good question, and I can't answer down to that level of detail, but if you want to talk to Liz Helcom, she probably will be able to give that answer, much as I'd like to.
Anyone else with a question before Deb sits down? Okay, thank you so much.